documentation. Well, this is Andrew Williams Jr. and John Camaro. And of course, Afya Rekod is the topic. But since we have this opportunity, John, I'd like for you to bring us up to date with what's going on with you. And I want to thank you so much. It's been a while since we met, but you've always been in my heart and my mind. I look forward to finding ways we can work and network together.
Yeah, no, it's good. So we've just been proceeding with what we started to do, which is try to bridge the gap with patients and data, and using patient-centric approach to healthcare, especially around technology with records, obviously preventive healthcare, and also connecting a whole ecosystem of healthcare. So that's what we've been doing. And I think in 2.5, 3 years now, I think we've kind of like slowly preached the same message to everyone. We've slowly started getting the recognition bit by bit, but it's happening now because I guess people are beginning to realize that, especially in emerging markets, but globally, patient-centered healthcare will be the driving force of the $1 trillion market that we're talking about. So what we're doing is we're building multiple platforms, not just one platform, that then connect at the centerpiece of patients. So either in the hospital, outside the hospital, when you go to a pharmacy, when you self-medicate, when you go to an insurance provider, even when you're out on your own, also being able to, be mobile with your data. So the patient becomes the centerpiece of mobility and sovereignty. So either we connect to a hospital by providing them with our platform for mobility healthcare to do record keeping, management, hospital systems, all that very boring stuff. But the key is the mobility. When the patient goes from there to anywhere else, they're able to see his record, irrespective of the hospitals are not connected. Either the patient gets that record directly, and then when they go to another hospital, they add that hospital, or the patient actually goes to a hospital that we've also connected in the network. And then when the patient also goes to a pharmacy outside the network completely, we're also connecting pharmacy because we're building pharmacy software, because that's where most people engage with healthcare first in Africa. They go to the pharmacy to buy medication. They might never go to the hospital for a whole year, but they buy medication 50 times in that year. So connecting that back again. So for the first time, your doctor can see what you're buying in the pharmacy, without him having to ask you every time he has to ask you a question. What have you been taking? What have you been buying? All that nonsense. Okay, connected back. Same way you connect the patient again back to their other healthcare providers, their GPs. But then again, the patient now has all these data. Now, if I go from US to Mexico, or if I go from Nairobi to Uganda, in case something happens to me in Uganda, I can share with them my health record before they start treating me in Uganda, even if the Afya Rekod is not in that hospital. So, but also on the flip side, the patient can start the journey themselves on my record, where they just go and onboard themselves and start, managing their own health record themselves. So they start collecting it from every hospital they've ever been to themselves. So they collect the record of themselves, their kids, their family. So now they begin to concentrate their records into one place. They can share it. They can do all sorts of things with it. They can connect within the ecosystem. They can get a lot of knowledge back as well too. So they start, so the day they do go to a hospital, they can say, hey, look, here's my record before you treat me. Or to a pharmacy, they can collect the data. And then when they finish in that hospital, they can say, hey, can I have my health record back? So it's really decentralizing ownership, but using that ownership as the mobility we need in the network. So that's the one thing. Then on the flip side is with the health workers, what we realized, the reason for the biggest reason for the lack of adoption is lack of knowledge. Health workers do not have any idea of what we're talking about when we talk about digital and data-centric healthcare.
Right.
A lot of these people haven't been trained for years. You have nurses who have never had any training upgrade, but then they don't even know what technology really is. So how do you expect all these hundreds and thousands of people to adopt this thing? First, they don't understand the value for them. They don't see it. They think it makes sense, but they don't really care much. And this is like 2 years of research.
Right.
So now we've started building training programs to train health workers on digital and data-centric healthcare. The value for them first, how they can use it to make more money, how they can use it to buy more time, how they can use it to upskill themselves, and the value for the patient that they're trying to save life. The same thing for young doctors as well, and for regulators. So we started the first program with the Nigerian National Health Insurance Fund just in November, and training a lot of their officials and a lot of their health workers. Because some health workers
Now,
haven't
where is that? In which country is that?
Nigeria, the Nigerian Health
Okay.
Insurance Fund.
Okay.
So, I was in Rwanda for the big CDC event, and I think Afya Rekod was centerpiece because they realized that we've been preaching this thing for 3 years.
Right.
And just building systems around it. And they're like, everybody has to focus on patient-centered healthcare, and everybody also has to focus on scaling up the continent with understanding of digital and data-centric healthcare for patients. If our health workers do not have the skills or don't understand what it means, then even when they adopt it, they don't actually understand why they're adopting something. So that's also another thing that's just, next year is going to be huge around capacity development in that space for me. So again, championing capacity development to upskill the continent to really understand, and then also championing patients to start becoming the curators of their own health record. Forget about putting systems in hospital. Whatever record exists, as a patient, I want it. And I want to put it somewhere so that when I go to another hospital, I become the mobility, in this fragmented ecosystem. And for the hospitals that we power, the pharmacies, the labs, our partnership with General Electric Healthcare, GE. So we're connecting all the X-ray equipment across multiple hospitals. So when you go to a hospital, when you're done with them, if you have our MyRecord platform, the system will just send you a copy of your X-ray directly. It doesn't even have to talk to the hospital. So those are some of the cool stuff that we're doing. So it's been a hectic year trying to, but I think for the first time last month, people sort of began to understand what I have been evangelizing for the last 3 years.
Okay.
You cannot change anything if you don't change the system.
Right.
And the system should not be a system. The system should be the most common denominator, which is the human being. That should be the system. The system should be built around the human being, not around an infrastructure.
Agreed. So that seems very relevant then to this particular group that we're meeting with soon, dealing with the healthcare workers themselves. So you believe that's an accurate place for us to begin to connect the dots for education and awareness?
Both. It's simultaneous. You can't, you have to do both. There's not one or the other anymore.
Okay.
So you have to do both. Whatever one comes. So we're training health workers now. We're raising funding to train more health workers. We're also educating patients. So we're stepping outside the hospital. We're going into healthcare, which happens outside the hospital.
Right.
And 1.3 billion people in Africa participate in healthcare before they get into treatment. So if we can catch them at healthcare, that means we've already gotten the captive audience even before they go to the hospital. So they will be the ones that will now start getting the people in treatment to understand. Because if I understand the value of something for me, when I go somewhere, I'll tell the person, well, this is what I want. Not the other way around anymore.
Well, you have over 120,000 patients registered on your website. Are those primarily?
Right now, we have about 240,000.
Now, are those all in Kenya, or where are those patients?
No, across 6 countries in Africa: Nigeria, Kenya, South Africa, Tanzania, Zambia, and then the UK.
So then at least people in those countries can right now go and register to become a member of your network or not?
Yeah.
Is that a yes or no?
Yeah.
So AFYARekod.com is the place where people can go to learn and to begin to connect the dots?
Yeah, so they go to myrecord.com.
Okay. If you could put that in the chat, I'll share it. We are streaming this live on Facebook. We do have a group, John, where throughout the year, we typically every week, we schedule and live stream events. I know this is impromptu, but I want to thank you so much for giving us this opportunity to do that with you as well. I do want to let you know that in addition to Afya Rekod, the Adanian Lab, I think, is your engine for venture funding to support this and other projects. Is that correct? How does that work?
Yeah. So basically, we use that to help support projects, to help scale them. accelerate them. So we go raise money from different partners, grants, fund organizations. Then we launch the studio in different countries, and then we help accelerate companies in those countries. But also we then help with the cross-border trade of opportunities for companies from one country to the other through our labs that we're building across Africa. So we have about 5 now: Kenya, Tanzania, Nigeria, South Africa, and Zambia. So we have 5 studios in the continent now. And yeah, so just basically helping to accelerate businesses to create capacity around talent, to create business optimization strategy to help launch those businesses, and then to help give them a cross-border opportunity. And then, go help find funding and funders for them. And also then build like a huge talent capacity. So we're trying to train 1 million software developers to also then impact the value of those businesses as well. So yeah, it's a pretty ambitious project that we started again 3 years ago, but so far so good. We've I think we've probably touched the lives of over 300 startups across the continent. We've accelerated about 50 in 5 markets. We've trained just over 3,000 people. And yeah, we just keep going.
On that note, I was recently introduced to an advisor to high net worth individuals. And my question to you, John, is it possible for us to also look at the third tier, which is bringing in investment, because what you're doing impacts all the sustainable development goals. This is supposed to be the decade for action to deliver the sustainable development goals. And it looks like what you're doing impacts not only number 3, which is health, but impacts number 17, global partnerships for development. As I understand, you have a working team of people from around the world making sure this gets done.
No, for sure. I mean, trying to get a lot of high net worth guys to, invest in what we're doing, or co-fund, or be philanthropic. That is one of my agendas for this year. I mean, part of what we do, I have a strong bias for women. So we're building a lot of women entrepreneurs. We're building a lot of, entrepreneurs from displaced communities. We're building a lot of capacity as well across the continent in smart technology. So we're taking a position with climate technology, climate awareness across a few countries in Africa that we're starting next year. Yeah, so we're basically sort of like an impact studio, really. With and a lot of these things we've done ourselves just to show that it's possible if you believe in yourself first.
Right.
And then good people will come find you and join you. And so, like what I tell people is I started all this thing with my own money because I believe it, and I still believe it. And I think that rather than waiting for people to come tell you what to do, the little that you can do, you get started and you just keep going.
Right. Well, as I understand it, you were inspired by a personal experience that you had with one of your best friends who may still be with us if Afya Rekod had been existing at that time. Can you briefly touch on that
100%.
before we wrap up here?
Yeah, I mean, the whole reason of Afya Rekod existing is because of the mobility or lack of mobility of data that killed a friend of mine. So, going from not being able to go from one hospital to the other for them to understand what was wrong with him so that they would have actually taken the right action. It wasn't their fault, but just the system was so broken that they didn't know what they thought was right, which was right, but it was wrong because they had no understanding. They were completely blindsided. And that kills over 33 to 37% of people in Africa and probably globally. So for me, Afya Rekod is a personal life challenge.
Right.
It's not even a business.
Right.
It's not a business. And I tell people, it's not about I'm selling software. I couldn't care less. This is a personal challenge to save the lives of more people. Right.
Well, count me in. I've been an avid supporter of you since our meeting several years ago here in Los Angeles. And I do want to thank again both Ian Hale, excuse me, and Dr. Nelson, who connected us together through IFRS, the International Federation of Education and Research. So I do want to give thanks to them, John, but I'm going to send this little video along to the investor that I talked about with your approval. And with that, I'm going to
Yeah, that's
wrap it
fine.
up for today, and we'll follow
No,
up
thank you.
as soon as possible.
No, thank you very much. Much appreciated, Andrew.
Sure.
As
Have a
always.
wonderful day.
Thank you, sir.
Okay. Take care.